Hi, this is Katrina Lamont doing her Cardioversion OSCE. So, as I approach the scene, I make sure that my PPE on. Is the scene safe? Yes, the scene is safe. I enter the house. I have defib, oxygen section, and bag with me. Sir, can you hear me? Hello, sir.
No.
So the man responds with thumbs down. As I'm looking at him, I can see that he's an older male.
My chest is very sore.
He's in chest pain, so I'm going to be getting a free lead on him right now. Sir, what can you tell me about the chest pain?
It's just very, very painful. I've had a bit of a collapse. I'm quite dizzy and confused now.
Okay. Have you previously had chest pain, or is this the first time onset?
Well, I had an MI about 5 years ago, but this pain feels quite different actually.
It feels different. Okay. Are you currently on any medications?
I'm on Cilazepam and aspirin.
Cilazepam and aspirin, okay. And how long ago did you have a cardiac event?
This one or my MI?
Your MI, how long ago did your MI
about 5 years ago.
Okay.
Feels very different.
It feels very different, alright. And so were you sitting down when you collapsed, or what occurred?
I was just cleaning up. And I kind of collapsed, but I fell here on the couch.
Okay. So I'm having a look at the leads, and it's showing me that he is in VTAC. However, given that he is conscious, I'm going to be cardioverting him.
Check patient.
Right. So, AUT1 calls comms.
Go ahead.
Requesting an R54 status 1 conscious VT patient.
Sure, that'll be about 15 minutes away.
Okay, thank you. So before I do anything else, I'm going to be taking some vitals. But I suspect I am going to have to put in an IV. So, because of IV, I'm going to just put this on the other arm. Okay, so you previously had an MI and that occurred 5 years ago?
Yeah.
Do you have any other medical history I should know about?
No, just old age, really.
Just old age, alright. And are you normally compliant with your medications?
Yeah, I think so, but I'm quite confused today.
Okay, so this patient has a decreased GCS. He has cardiac chest pain, and he's in a fair amount of pain in transit. I'm getting a blood pressure of 70/40, yes. So he's also hypertensive. And I suspect that he might have pulmonary edema, so I'll just have a quick listen to that. And if so, then he's definitely cardiovascularly compromised. So having a listen, just deep breath, sir. Yeah, I can hear pulmonary edema in there. So the patient is positioned lying supine. I'm going to continue to keep him like that. And I'm just going to be getting in an IV. And as I'm going to be cardioverting, I'll also be giving him pain relief. Given that it's going to be a cardioversion, I will be giving him fentanyl. A typical dose is 10 to 50 micrograms every 3 to 5 minutes. As this is going, like I said, it's for cardioversion. I'm going to be giving him 40 micrograms to begin with. And then I'll be going through a cardioversion checklist so that we'll have time to kick in. Right. This would be a 16 gauge, but due to the mannequin, it's not. And once I've done this, I'm going to be taking a 12 lead, so I can have a proper examination of the electrical activity of his heart. given alcohol swab, level up, surprise, tension, insert, I get flashback, tank nose, and into the sharps container, lure on, get off here too. Cool. Shoot. Paddle these off. Joy. Okay. So good. Alright. Okay. Flushing. I'm just going to be giving you some perineal stir as soon as this is flushed. Okay, it's flushing cleanly, seeing no signs of tissuing or extravasation. He does not appear to be in any more pain due to the flush. Cool. So I have here fentanyl. It expires December 2016, 100 micrograms in 2 mils. Offsider, I think. Random passerby, can you please have a look at this?
Yes, it's fentanyl, 100 micrograms in 2 mils, expires 12th of the 16th, so it's definitely in date.
Wonderful. So where the hell is it probably?
Next pocket, one in front. No, pocket in front. Yeah.
That one. I helped you put it there. Okay, right, so putting on there. 12 grams. Cool. 12 is attached. Thank you. Fentanyl. So I'm going to be drawing up all of the fentanyl as well as 8 mils of saline. And I'm going to be giving 40 micrograms. I'll be then administering 4 mils. Where is it? There's this switch. Cool. Oh, sharps. Right. And saline. Cool. Sharps down. Right. And 4 mils of fentanyl. Cool. I'll leave that there in case service stations required. Alright, I'll be getting out and I will then flush it. Just because. Alright, so cardioversion checklist. Place pads. Pads are placed. Shortest provider is a manual mode. Check. Select limb lead with the highest R wave. So that is lead 2. Select synchronized mode. Okay, synchronized mode selected. I am indeed seeing the detection symbol above every QRS complex. The patient has been given sedation. Sir, can you hear me? How do you feel? Right, he doesn't respond, so he has a decreased level of consciousness. So I assume that the pain relief is working adequately. Right, charging up. Okay, so everyone standing clear of the patient. All clear. Okay, and hold shock on. Cool. So shock delivered. Okay. It seems to still be in VTAC. VT is still high. Sir, can you hear me? Sir? Okay. So he's not responding other than coughing, so and due to the fact that the rhythm hasn't changed, I suspect that a further shock is needed, so we'll do a quick set of obs, give further sedation as required, and then shock him. Shit. Alright, so he's just almost turned to the side, grab a suction, which is right here. 30 seconds. Okay, I'm not seeing any further obstruction. He's talking to me. But I have a suction here if need be, and I'll be putting oxygen on as soon as I finish doing my obs, and then shocking him. And I'm going to leave the head in that position so that if he does vomit further, then it's less likely to obscure his airway. I'm still getting 70 over 40 for the blood pressure. Cool, I'm looking at him, the patient still seems pale. Cap refill, 3 seconds. And rhythm remains the same, so I'm going to be giving him another 40 micrograms of fentanyl. And I will then flush. And I'll then cardioversion, and then get him on some oxygen and have resus gear here below just in case. So, cardioversion checklist. Has a place to defibrillator manual mode, select highest, lead with highest R wave, select sync. Syncing there's a detection symbol of every QRS complex. The patient has received adequate sedation. Charging. Okay, everyone's standing clear. All clear, there is nobody touching. Okay, and shocking. Cool. Alright, so the patient has now gone into a sinus rhythm that's very tachy, so it's 50 minutes from back of his coming. I'm going to be placing oxygen on him, and I will have resus here nearby, just in case that this could perhaps have been caused by an overdose of silazepam. So resus here. What else? Could have been caused by an overdose of silazepam, or perhaps hyperkalemia, or maybe hypomagnesia. Hypermagnesia, 26, sorry. And nasal prongs. Who doesn't like nasal prongs? So giving oxygen on him, and then I will be continuing to assess vitals as need be.